everybody. And now let's talk automation.
Happy third Thursday, everybody. And I have to take a moment to acknowledge how excited I am that Kieran showed up as a leprechaun. I thought that I was going to be the most festively dressed in my green with my little gold headband, but Kieran has delivered and came to have this discussion.
This is the way I dress all the time, Emma. I just take it off for third Thursday. It's coming off in a second. This is...
The fact that you own it, and you wore it and you came through after my public humiliation of asking for you to be dressed as a leprechaun, I feel pretty excited about this development. So happy third Thursday and happy St. Patrick's Day to everybody that's joining us today. We've got a really great conversation coming up with Will and Olly, who I'm going to bring on here in a second for some of our normal introductions. But throw a quick comment into the chat. Let us know where you're joining from. Wish everybody a happy St. Patrick's Day. Or if you're not as Irish as Kieran and I, and you don't want to celebrate the holiday, then just say something else pleasant to everybody who's joining us. And we're going to get started. I'm going to bring Will in to get his introduction, and we're going to kind of go through our normal icebreaker process as well. And today we're going to talk a little bit about the idea of why we are all passionate about this idea of AI and technology coming into the space of healthcare. There we go. A little bit more. And so I'm going to kind of start with my little icebreaker that I gave everybody as a quick teaser when we were first getting started and moving through production or promotion of the event. But for me, my thought process, I don't work in healthcare day in and day out, but I see healthcare as something that is essential for every single human. And I've had a couple of probably more intensive health experiences than I think some of you guys, based on at least the conversation that I had with Kieran and Olly. With both of my daughters being premature, we had a 6-week NICU stay with our oldest. Multiple times a week appointments with our youngest, tons of imaging, tons of shots, and all sorts of things. And going through that experience, I learned the importance of being an advocate as a patient for yourself and your family. But then I also saw that at the end of the day, doctors are humans too. And while you want answers and you want them to be able to give you all of the information that you need, they're just humans, and there's only so much they can have in their brain and how many answers they can provide for you. And so through that experience, my view of healthcare changed a lot, and my view of how we use technology or where we might be able to use technology changed a lot just from that personal experience. And so I'm going to come to the rest of the group, and they're going to have different answers for why they are passionate about this topic. It's not... None of you guys have had a baby. So we'll start there. But so Will, I'm going to come to you first and ask you the same question and have you do your quick introduction while we're waiting for comments to flow in and folks to let us know where they're joining from as well. So make sure that you're commenting there.
Yeah, thanks, Emma. So yeah, hi all, I'm Will. My day job is I'm a Group Chief Digital Officer of an investor services company. So not a great deal to do with healthcare, but I started my tech career leading an IT outsourced account at Cambridge University Health Trust and Annabrookes Hospital in Cambridge, one of the world leading cardiac hospitals in Papworth, coming over, and one of the largest hospitals in the UK. So it was very close to healthcare at the start of my career. I'm of course not here with my investor services hat on. I'm here with my academic hat on. I'm also a doctoral researcher into the field of ethical AI and the impact on gender and ethnic diversity. My initial research was focusing with Great Ormond Street into areas around operational management of pediatric cardiac surgery. I had to move my research for reasons to do with the awards body, but I wanted to stay in that area of ethical AI. I know Kieran well, I've met Emma a couple of times. Olly, I'm really looking forward to meeting you and hearing what you have to say. And that's my interest in healthcare and why I'm here today, and hopefully can talk about the ethics of using AI. Applied AI in the healthcare area.
Wonderful. Well, thank you for that. And I want to, before I come to you, Olly, because you're next on my list, I want to just jump in. One, Kieran, I'm not the only one that is excited that you dressed up like a leprechaun. This campaign worked, and now I feel like I need to start making up a theme for every episode for you to dress up for. But we've also got folks coming from, I saw a number of people in the UK. I see Boston. I see Nigeria as well. And I'm guessing maybe in Nigeria, you're probably not quite as focused on wearing the green, but you'll have to let us know in the chat if that's something that you're supporting today as well.
One of the biggest countries for Guinness is actually Nigeria. Believe it or not, it's actually a far stronger version than the Irish version.
Ooh, the things you learn. So Olly, I'm going to come to you with the same question. I want you to share a little bit about why this is a topic that you're passionate about and share your introduction. And again, keep the comments coming in, everybody. We love to see where you're joining us from.
Yeah, thanks, Emma. Hi, Kieran. Hi, Will. Yeah, so great to be here. Love the Thursday. It's an amazing show that you and Kieran have put together, Emma. So yeah, good to be an honoured guest. So yeah, I'm Olly Cogan. I founded Alpha Lake AI. We're a startup. I think we're still classed as a startup 3 years in. So an established startup, I think, is an oxymoron. We work in health tech, particularly intelligent automation in healthcare. So we got into the industry because we saw a lot of opportunity to help healthcare drive through more drive through a lot of operational efficiency, but ultimately improve workforce experience, which in turn then translates into better health outcomes for the patient. We work a bit with RPA, but we've come on a bit of a journey with that. So we use sort of, as I say, robotic process automation. A little bit sparingly, in the right dosage, to use a clinical term. We tend to prefer the sort of no-code API approach, where we integrate a sort of vendor-agnostic approach to RPA, but we lead with a technology called Wakato and our own AlphaBot for Teams platform, which actually comes with our new little plug there. You can't see it because of the thing, but we've got a new bottle that's called now it's ruined. It's ruined. The instruction's ruined. There's a bottle there that is our new Alpha bottle, which is in front of me, which is I wanted to show because it's a genius play on words. So we have our own AlphaBot platform which runs in Microsoft Teams called AlphaBot for Teams, and that's a human machine interface to help move information through clinical workflows better, and based on sort of integrating with our no-code connectors that are based on technologies like Cerner and Epic and a range of other sort of clinical electronic health records, and yeah, just trying to improve information flow and readiness and access to information in healthcare, and augmenting that experience with better data intelligence in the mix. So yeah, that's me. That's more about the company, but and I've got a passion for healthcare and improving it, and look forward to a discussion on sort of the ethics involved in that, and sort of how that can drive operational efficiency in the near term and into the future.
Gotta be quick on my mutes today so I don't get stuck. Thank you, Olly, for joining us. And Kieran, last but not least, if you want to do your quick intro, and then we'll jump into the meat of our conversation today.
Yeah, folks, welcome. Happy St. Patrick's Day. I did put it in Irish in the actual chat session. Please do not ask me to try and pronounce that. That might be very embarrassing for all of us. Look, I've been in automation, been in intelligent automation space and data analytics and everything else for the last 27 years. Absolute passion for it. From the medical side of things, not the same experiences as Will. Not the same as Emma. I don't think I've had a child. My wife has had two, and very tough experiences, both of them. And I think each of those and some of the medical experiences that I've come across as well really show the dichotomy. You end up where we are in life at the moment with the best medical equipment that you can imagine in terms of imaging analysis, X-ray machines, you name it, it's there. And then if we look at our own experiences, you tend to turn up, you meet a nurse, doctor, medical professional, and the experience is incredibly manual. I remember one where I ended up getting tetanus at one stage from a can and a bin, and ended up getting injected about 18 times. And the nurse hadn't done it before. And you're sort of going, yes, I will take a robot doctor anytime doing that. And just love your point, Emma. One more thing before we jump into the session. There is no medical profession that I've ever met in my life who does not want to do the best job possible. For me, technology, and particularly the AI, the imaging, the scanning, the genetics, whatever else it is, biotech, you name it, really exciting space. because if we can give amazing medical professionals amazing technology, maybe we'll remove some of that manual stuff that we all see happening as we come through the door, to free doctors, nurses, and medical professionals up, including mental health professionals as well, which we'll talk about later on, to continue doing an amazing job.
Wonderful. Thank you, Kieran. So as our title suggests and what we've kind of teased a little bit here today, we're going to be talking through some use cases, but rather than having our whole conversation focused on us listing off use cases that you could go and Google, we're going to talk about some of those, but then also talk about them as it relates to what this means for changes within healthcare, ethical considerations, and kind of how technology, because anybody that knows me knows I care more about how it addresses people and the people that are at the center of the healthcare system. And so our conversation is going to include some of those use cases, as well as discussions about how this will impact what we see healthcare doing in the future. Kieran, you mentioned ideas of things like being able to, in the biotech space, sequence all different types of DNA, and even looking at the COVID vaccine and the types of advancements that we've made. There's some really, really incredible things happening across the entire life cycle of our healthcare system. But I want to start with a conversation, Olly, coming to you to talk about, what use case are you most excited to kind of see hit the forefront of our healthcare system as it pertains to AI?
So in terms of the most in terms of the use case I'm most excited about, I'd say we actually got into automation from a business perspective because we felt that could drive very tangible impact in healthcare. We knew we wanted to sort of get into sort of AI space and drive that impact in healthcare. But I remember having conversations with my co-founder at the time around automation was something that could really actually was here and now, and you could buy it. Was a thing you could buy it. It was packaged up. It was something that could be applied. And I think this was 3 or 4 years ago. At that time, it was early days in terms of some of the radiology image recognition. I was at an event yesterday with one of our customers, NHS Sandwell and West Birmingham, that with IBM Watson in healthcare, and what they're doing is incredible around how far they've come in 3 years in terms of some of the image recognition. So I'd say what I was trying to explain there was the other area where there is actually really tangible applied AI is obviously in image recognition. I think there's, on last count, there's something like 100 different offerings in the market from different tech companies now around radiology linked or image recognition in healthcare. So that sort of the machine learning that's been applied to that drives very tangible outcomes, and the efficiencies that can be achieved through that are significant, and the change on workforce experience and the strain that exists in organisations like NHS is huge for the level of reads and scans that radiologists are having to do, and in the NHS, for example, they actually they double read, so there's actually it's even more significant level of operational efficiency that can be realised. So that's definitely the most tangible. In terms of exciting, I think there's still a long way to go with that. Whilst there's kind of here and now return on investment happening, it's still quite isolated in specific areas such as lung nodules or scans on the CT scans on the brain. And when that starts to all come together and bring in sort of the infusion of AI into the information being made available to the radiologist or the doctor or the nurse or clinician at that point in time, and how that can change the holistic view of the patient. So not just looking at a scan, but actually seeing information that's been received through structuring data from the electronic health record, for example. Is this person a smoker? Are they not a smoker? That contextual intelligence that can come from looking at a patient more holistically. I find it quite interesting that as healthcare has become more holistic, that it's not an accident that the technology around healthcare is also becoming more integrated. The sort of the domains of healthcare are becoming we are all connected in our human body, and the technology and the silos need to be better connected to handle, a patient from, one area of one department in healthcare to another. So I think AI is going to play a very key role in actually not just augmenting the workforce experience and that machine-assisted doctor. And there's some very interesting ethical questions coming out of that, of where the buck stops, which I'll happily pass over to Will. But in terms of you can handle the difficult ones, Will. But in terms of in terms of just the excitement for what's going to come in the next sort of 10 to 15 years, I think we're going to see so much more information readily available to an experienced clinician at that point in time, not just in scans of imagery, but actually, intelligence in terms of how that information is being assimilated and decisions being made. And at what point the humans in the chain in that is the really interesting question ethically. But yeah, I think exciting to see how we extend beyond just the image and recognition that's going on. And then obviously NLP is going to play a very, very great key area in that as well.
So you teed me up nicely for this next question, Olly, to head over to Will. And my thought process, again, specifically when we're talking about things like image recognition, we recognize that there is this huge opportunity for us to change the way that we're diagnosing all different types of illnesses. But how do we, from an ethical perspective, build out these models in a way that maybe don't have the same bias that healthcare providers may? Or also, we have just a couple of minutes, so you take this question where you want to, Will. But the other side of it is, what is the ethical use of data, and are people signing up to be a part of the algorithm definition? Are we using their data and their images without, anonymizing that data? How do we start to shape out these solutions, and what ethical considerations do we need as we're moving through that process?
It's a great question, Emma. And as you might imagine, well, there's two sides of it. You can be fairly dry and boring and look at the law. So I trained as a lawyer originally, so I won't bore anyone with that bit. I could go right the other side and go to be an academic and pontificate for days, weeks, months on end about what this may be. So in considering the answer, I think if we bring it back to core principles, so the World Health Organization published 6 core principles, guidelines. They're not laws or rules, but principles and guidelines around the ethical use of AI in healthcare. And those 6 are protecting autonomy, promoting human safety, ensuring transparency, fostering accountability, ensuring equity, and promoting sustainable AI. So there are 3 that I'll quickly focus on in the couple of minutes we have. So the first piece is ensuring transparency. Now, a lot of people have heard about explainable AI, black box versus white box, understanding the decision tree and what's going on. One of the areas that I look at in studying the ethics of the application of AI rather than the science of how we build it is, at what point in time does something go from being transparent to not being transparent? How much do we care about the benefit of the outcome of this system versus the true understanding of what goes into it? For instance, when's the last time we said to a surgeon who's recommending that we have a triple heart bypass, why exactly have you recommended that? And they regale to us the 20 years experience they have as a cardiac expert. So in some ways, why do we need to ask this of the AI? And if the answer to that is because we have to, for insert reason here that we could debate for a long time, the next question becomes, who can ask that question? And that comes back then playing off to the first principle of protecting autonomy and never moving away from human-centric treatment, and that a person should have the autonomous capability to decide their own fate. That in itself, and I won't dig into this, but mainly because I noticed a name join, whom admittedly I don't know him very well. I know a lot of his colleagues, Gary from faculty. You certainly weren't expecting me to call your name out, buddy, but I saw you join. If you have 2 minutes to go and look at some amazing use of AI in the healthcare space, in the government space, go and look at what faculty were doing with their early warning program and how that helped our reaction to COVID. But what I want to react to again is all of these principles have a yin and a yang. We need to protect autonomy, but at what point does it move from the individual to the greater good, a la what we did to combat the COVID challenge? The 2 other pieces I want to touch on very quickly, because I think this matters more existentially than looking at the individual algorithms, say in oncology imaging, are ensuring equity and promoting sustainable AI. the vast majority of AI capability in the world at the moment is either written in English and typically comes out of the US, although of course there are other states that do the same, or in simplified Chinese and is coming from the Chinese labs. How do we ensure equitable application of this in various different languages, various different cultures, various different areas? And hopefully later on we'll talk a bit about bias, and I'll be able to talk back as to why the culture bit matters when we look at AI as well. The other piece then is sustainability. If we're in the US healthcare system, UK healthcare system, or a wealthy country's healthcare system, we can probably afford to run, whether it's through SaaS or in-house, complex AI algorithms. How would I deploy this into an emerging economy in Africa? And why would I not, if people say, well, they're not ready for it yet, or what comments can come back from that, why would we not be looking to make this completely globalized and ensuring that we have a sustainable, equitable capability of deploying AI? So they're the sort of areas that I'm researching. Interesting, you can pontificate them for ages. I mean, I'll happily answer any direct questions, but they're the things that go through my mind when I think about where can we apply these advanced technologies in the field of healthcare.
Dang it. I thought I was going to make it. I put it in the chat, but Will, I can't even say the word, pathenticate. There we go. You used it twice. Now you get an extra 1,000 words and a tongue twister for me. So I want to, and I've seen a couple of comments coming through in the chat that are, again, Olly teed me up for my first question, and now the audience is teeing me up for the second. So Kieran, I want to come to you to talk a little bit about this idea of, as we see technology introduced, and I want to talk to you about it from the patient perspective, and then we're going to open up the conversation a little bit more across the group. But talking about this idea of, when we talk about intelligent automation or digital transformation as a whole, it's the idea of taking away the tasks that can be managed by technology so that people can focus on the parts of their job that bring them purpose or challenge them or bring a lot of value to the organization. And but I think that conversation starts first from the patient perspective. So as a patient, how do you feel about the idea? You said, bring in the robot, let them give me my IV or my shot. How would you, from a comfort perspective, feel if you knew that it was AI algorithms and or technology that was helping drive your care decisions from an ethical standpoint as a patient? And then I want to open it up to talk a little bit more about what does that mean about training and upskilling doctors and nurses who maybe have always been the analytical thinkers and now need to be the people. But let's start with that patient conversation first.
Yeah, I think the patient conversation is a difficult one, Emma, because I'm slightly biased and that I come from a technology space, and something that I'm a firm believer in as well is not necessarily just what the patient wants, i.e. the customer is the classic one. Because when I look at AI, I'm thinking, all right, I've seen a recent chatbot where the creators of the chatbot themselves, who help people with mental therapy, believe they have removed bias. So in terms of my confidence in that chatbot compared to medical professional, if bias has been removed, then I'm absolutely delighted. So again, it's a terrible thing. We're bred to think some things where people are slightly poor. Maybe we believe they don't look after themselves, and therefore do we give them the same element of treatment as someone who's really well off? As a patient, as someone who understands technology, I do believe we should let the medical professionals decide, give them an option or show them the art of the possible. But I want access to my own data. So for example, we've seen with Fitbits or anything else or other manufacturing tools, the fact that I can record that I'm doing 10,000 meters a day or feet a day or steps a day is absolutely amazing. I want to know that. I want access to all my data. I want access, and I want to know where that data is going. I've seen in the UK a couple of years ago, there was an agreement between Google and the NHS for a period of time, and probably all very valid and everything else. But unless you were made aware of that, and I certainly wasn't until there was a bit of a furore in the press, that I wasn't conscious of where my data was going. And I want to make sure I'm not talking about as a patient that I don't want to be a Dougal. And Dougal, by the way, is the phrase for when we're now all medical professionals, because we've got Google and we pretend we're doctors. We look up all the illnesses we got, and somehow, despite the fact it's a simple cold, I end up with rinderpest or something absolutely magical that can only happen in a particular part of the world, never mind anything else. But I think we need to educate patients, and in the nicest sense, we need to educate the medical professional as to what is out, what's actually happening with the data, how it can be used. And then we give people access to their own data to allow them to make some of their own more informed decisions about what's actually happening to them. But until we do that, until we're highly transparent, I think as patients and as people, we'll always be suspicious that our data has actually been used for something that's not necessarily purposeful and helpful. We'll worry that our data has been used for something that's actually less helpful and less beneficial. I have to say, I do trust doctors. I do trust nurses. I don't expect them to be the most perfect people in the world. That's physically impossible. But if we do give them the technology, and again, we've mentioned NLP, AI, and a whole host of other technologies, we could look at AR, VR, you name it. I'd be much more confident in the medical profession if they were given all that tech and all those experiences, as opposed to, I suppose, what many of us seen as patients. And it's not a criticism, it's just the reality of being a patient, that when I was in hospital, a consultant came in, dragged along was a sequence of junior doctors, and the way they were learning was by seeing something that was happening. But again, if you haven't seen it, you'll never know what to suggest. And in my instance, I got sent home because it was just a virus, whereas actually I was in the middle of having blood poisoning. And again, if someone had seen that, had access to amazing augmented technology, whatever that looks like, I'd be a lot happier. But just explain to me what's happening in words that I can understand, and let me know what's happening to my data and all of my patient records, I'd be a lot more comfortable.
So Ryan said it, and we've heard it before. Ryan, we know that 30 minutes is not necessarily enough to explore all of these, but I want to send a reminder to everybody that any questions that we don't bring up and have a conversation about, we will go back and interact with those in the comments. I'm going to leave we've got 3 minutes, so it's not a long time. And I want to just kind of open up the discussion then to Olly and Will. And I'm going to kind of give you guys like buzzer, whoever speaks first, to start talking through the conversation. But as we look at this, Kieran mentioned the idea from the patient perspective, but what types of considerations do we need to be making in terms of the role of the doctor interpreting data that's coming from AI solutions or other technologies that we're bringing in? How do we, again, start to train our physicians and nurses differently to be able to adapt to the idea of technology coming in? I shared an article yesterday, and nestled in there were some stats that, like 97% of physicians trust that AI can help them make decisions. We're getting to the point where it's no longer this idea of I know better than these algorithms or not trusting technology, but now there's probably going to be a wave of fear associated with what is my role if I'm not the one making those choices. So how do we start to address some of that transition as we bring technology more and more into the space of healthcare?
I would just quickly say that the radiologists have completely embraced it and accepted, just because of the level of workload. They are under such massive workload. They want these tools and they want these solutions. There's just a huge strain on healthcare. And just on the earlier point about data trust, and I think, we're fortunate in the UK, we've got the NHS, which is a trusted brand, but there's a lot of interesting stuff happening with the solid technology from like Tim Berners-Lee and people like that, enabling data trust to be something that we control ourselves at an individual level. So that's going to evolve, and that's going to, I think it's about making individual choices about where your data is trust, but it's also the lesser of two evils. I think that sometimes the data can get in the way of driving through the innovation. And actually, if we've got really poor patient experience dealing with healthcare in a lot of countries, how can we improve that on the ground? And we have a lot of conversation about innovation, but there is a difference between innovation and transformation. And there's great innovation coming through, but on the ground that transformation isn't happening. And I think we need to look at, if we can improve all of these outcomes, but then on the other hand there is some element of risk in terms of data, as long as that is the sort of, I don't want to say the lesser of two evils, but we have to have real, frank conversations about that, and they are coming through, and there is an appetite for it, and I think the change is near. But yeah, there's a light at the end of the tunnel, and it's not too long a tunnel for healthcare to be at the level that it ought to be in this day and age.
So Ryan, I'm going to listen to your request, and I'm going to let Will go, even though we're at time. We're running late, everybody, but we're doing it for a good cause. So Will, go ahead and share.
I'll be really quick then. It comes down to clear, defined accountability. There are clear, defined accountability streams when it comes to any other form of healthcare provision, whether it be in the NHS or in a private sector. It is typically quite clear as to who is responsible for each element. When you involve a non-human element, an AI element, then it needs to be plainly clear as to who is accountable, not just for the negative, but also for the positive outcomes. I mentioned that because a negative outcome is very obvious. If you wind up in a situation where an AI does something bad, you want accountability. But to leave you with something to think about, when we do things well and we repeatedly do things well, we come across something called gambler's fallacy, which is a sociological observation that if we continue doing well, we stop believing that we're doing well and typically try and cash out. You see this in private equity investments all the time. I think that some of the amazing work happening in AI is advancing at such a rate that the people running it are getting gambler's fallacy and worrying about whether they're doing enough to prove their competency. Clear lines of accountability will help us continue to advance in those spaces.
Thank you both for coming, and Mr. Leprechaun for making your appearance again.
Happy St. Patrick's Day.
I'm glad I got to see that. I was running 2 minutes late. Apologies. Thanks, Kieran. You made my day.
I do want to know that
1 year.
in the chat, there's some like really intense questions that we could never unpack in a half an hour coming through, but I would love to see conversation going back and forth about this. And there's a number of other, great thoughts and paragraphs coming into the comments that I just absolutely love to see coming in. So make sure that you're going back to the chat, interacting with one another there. Olly, Will, Kieran, and I will be in there sharing our thoughts as well. But as Mr. Leprechaun said, happy St. Patrick's Day, happy Third Thursday. Thank you for joining us for the conversation, and we'll see you guys again next month.